Question 1. Scenario. Dr. Alice is developing a simulation scenario for a group of nursing students to practice their skills in managing an emergency case of acute respiratory distress syndrome (ARDS). The scenario needs to be realistic, safe, and provide opportunities for the students to make critical decisions in a time-sensitive environment. Dr. Alice needs to ensure that the scenario will challenge the students' decision-making skills while fostering interprofessional collaboration with the respiratory therapy team. Given these considerations, which of the following elements should Dr. Alice prioritize when designing the simulation? A. Ensure the scenario only focuses on one discipline, such as nursing, to avoid confusion. B. Use a mannequin with limited capabilities and a simple environment to reduce complexity. C. Integrate real-time feedback from both the faculty and simulation technologies to promote critical thinking. D. Avoid including any unexpected complications in the scenario to maintain clarity. Answer. C. Integrate real-time feedback from both the faculty and simulation technologies to promote critical thinking. Explanation. To maximize the learning experience in a simulation, Dr. Alice should integrate real-time feedback, which allows the students to reflect on their decisions as they make them. Real-time feedback promotes critical thinking and decision-making skills, as students can make adjustments and corrections on the spot, and complexity should be high, and unexpected complications should be included to encourage problem-solving and adaptability. A purely single-discipline focus would not fully engage the interprofessional nature of healthcare simulations, and using limited technology would not provide the depth needed for a challenging scenario. Question 2. Which of the following is a key characteristic of a competency-based assessment in simulation-based healthcare education? A. It focuses on evaluating students based solely on their theoretical knowledge of the subject matter. B. It allows students to pass based on completing the minimum number of hours in the simulation, regardless of skill demonstration. C. It evaluates students based on their ability to demonstrate specific, measurable competencies in a real or simulated clinical setting. D. It solely measures the student's ability to perform tasks with considering teamwork or communication skills. Answer. C. It evaluates students based on their ability to demonstrate specific, measurable competencies in a real or simulated clinical setting. Explanation. Competency-based assessments in simulation focus on evaluating specific skills and knowledge that are critical for safe and effective practice in healthcare settings. These assessments measure how well learners demonstrate the competencies they are expected to acquire, both in knowledge and in application. Competency-based education emphasizes learning outcomes and ensures students are able to demonstrate proficiency in clinical skills, decision-making, teamwork, and communication. It is not solely about theoretical knowledge or just completing time in a simulation. Question 3. Scenario. Mr. Thompson is a simulation educator overseeing a simulation-based training session with medical residents focused on trauma care in the emergency department. During the debriefing, some residents become defensive when feedback is provided, while others appear visibly upset. Mr. Thompson is concerned that the emotional reactions of the learners may inhibit effective learning. What is the most appropriate approach for Mr. Tom? Take in this situation. A. Ignore the emotional responses and continue with the debriefing, focusing solely on the technical aspects of the simulation. B. Allow the emotional responses to play out without intervening, as the learners must learn to manage their own emotions. C. Acknowledge the emotional reactions, create a safe environment for open discussion, and use the debriefing as an opportunity for emotional and cognitive reflection. D. End the debriefing immediately. Prevent further emotional responses from arising. Answer. C. Acknowledge the emotional reactions, create a safe environment for open discussion, and use the debriefing as an opportunity for emotional and cognitive reflection. Explanation. Debriefing is an essential part of simulation-based education, and effective debriefing requires addressing both cognitive and emotional aspects of learning. It is important for the educator to acknowledge the emotional responses of learners and to create a non-judgmental space where learners can reflect on their performance and emotional reactions. Ignoring emotional responses or avoiding them could inhibit learning and personal growth. The debriefing process should involve both technical feedback and an exploration of the emotional experience to foster deeper understanding and improve future performance. Question 4. Which of the following is a primary challenge when designing simulation-based curricula for healthcare education, particularly in terms of integrating adult learning theory? A. Balancing the need for structured content delivery with opportunities for self-directed learning. B. Ensuring all learners are given the same type of feedback regardless of their learning needs. C. Using exclusively high-fidelity simulations, as adult learners prefer advanced technologies. D. Creating rigid learning objectives that leave no room for reflection or adaptation. Answer A. Balancing the need for structured content delivery with opportunities for self-directed learning. Explanation. Adult learning theory andragogy emphasizes the importance of self-directed learning where learners take an active role in their educational process. Balancing structured content delivery with opportunities for self-directed learning is a key challenge. Adult learners bring life experience to their learning and often prefer to engage problem solving and critical thinking rather than simply absorbing information. Providing opportunities for autonomy in learning while still offering necessary guidance is essential for effective curriculum design. Question 5. Scenario. Dr. Patel is designing a simulation for medical students to practice managing a pediatric patient with severe asthma exacerbation. The simulation involves both the medical team and the nursing team, who must work collaboratively to stabilize the patient. The simulation also includes a role-playing parent who will provide realistic emotional responses. Which of the following is the most critical component that Dr. should focus on to ensure effective interprofessional collaboration during this simulation? A. Ensuring the medical and nursing teams perform their tasks separately to avoid confusion. B. Focusing primarily on medical interventions while minimizing the role of the nursing team. C. Clearly defining the roles and responsibilities of each team member and ensuring they communicate effectively during the simulation. D. Ensuring that the role-playing parent does not interact too much with the medical team to avoid disruption. Answer. C. Clearly defining the roles and responsibilities of each team member and ensuring they communicate effectively during the simulation. Explanation. Effective interprofessional collaboration is essential for healthcare teams. Clearly defining roles and responsibilities ensures that each team member, including both the medical and nursing teams, understands their tasks and how to communicate with one another during the simulation. This promotes teamwork, avoids confusion. Interprofessional simulations should emphasize communication and collaboration between disciplines to reflect real-world healthcare environments. Minimizing the role of any team or individual reduces the opportunity for effective collaboration and learning. Question 6. What is the primary purpose of integrating simulation technologies such as virtual reality, VR, and augmented reality into healthcare education? A. To replace the need for in-person clinical practice entirely. B. To create realistic scenarios that can be controlled and repeated for consistent learning outcomes. C. To make simulations more entertaining and engaging for learners. D. To limit the complexity of scenarios, making them easier for learners to complete successfully. Answer. B. To create realistic scenarios that can be controlled and repeated for consistent learning outcomes. Explanation. The primary purpose of integrating simulation technologies such as VR and AR is to provide learners with realistic, immersive experiences that can be controlled and repeated. These technologies offer the flexibility to simulate complex, high-risk clinical situations that may not be feasible in real-life settings. Enabling consistent practice and feedback, simulation technologies support learners in honing their skills and improving their decision-making in a safe, controlled environment. The goal is to enhance learning outcomes by providing repeated opportunities for practice and reflection. Question 7. Which of the following methods would be most appropriate for assessing the effectiveness of a simulation-based training program in a healthcare setting? A. Conducting only a summative assessment at the end of the program. B. Using a combination of formative assessments, learner feedback, and program evaluations throughout the course. C. Relying solely on self-assessment by learners to gauge the program's success. D. Focusing only on post-simulation knowledge tests without considering learners' emotional responses or teamwork. Answer. B. Using a combination of formative assessments, learner feedback, and program evaluations throughout the course. Explanation. Effective evaluation of a simulation-based training program requires a comprehensive approach that includes both formative assessments, ongoing evaluations during the program, and summative assessments evaluations after the program has concluded. Learner feedback is essential to gauge how well the learners are engaged with the material, and the simulation and program evaluations help assess the overall effectiveness and areas for improvement. Relying only on summative assessments or knowledge tests overlooks the value of real-time feedback and the emotional and team dynamics that are key to healthcare simulation learning. Question 8. Which of the following is a common pitfall in simulation scenario design that can limit the effectiveness of the learning experience? A. Overloading the scenario with excessive detail, making it difficult for learners to focus on key learning objectives. B. Incorporating unstructured opportunities for learners to explore different solutions, enhancing their problem-solving skills. C. Using realistic, high-fidelity equipment to simulate critical care situations that learners can easily control. D. Ensuring that all simulations strictly adhere to predetermined, fixed pathways. No room for learner decision-making. Answer A. Overloading the scenario with excessive detail, making it difficult for learners to focus on key learning objectives. Explanation. One common pitfall in simulation scenario design is overloading the scenario with too much detail, which can distract learners and hinder their focus on the key learning objectives. While realism is important, the scenario should not be so complex that it overwhelms the learner. The design should be tailored to on the essential skills and decision-making required for the learning goals. Overcomplicating the scenario can also reduce the opportunity for learners to critically reflect on their actions and outcomes. Question 9. Which of the following best describes the role of debriefing in healthcare simulation education? A. Debriefing serves as a form of summative assessment where learners are graded on their performance. B. Debriefing focuses solely on discussing the technical aspects of the simulation and does not address emotional responses. C. Debriefing is an essential tool for helping learners reflect on their actions, integrate feedback, and enhance learning through critical reflection. D. Debriefing is a one-time event that should occur only after the simulation, with need for follow-up or reflection. Answer. C. Debriefing is an essential tool for helping learners reflect on their actions, integrate feedback, and enhance learning through critical reflection. Explanation. Debriefing is a critical component of simulation-based learning as it allows learners to reflect on their actions and decisions, receive feedback, and discuss both the cognitive and emotional aspects of their performance. Effective debriefing involves guiding learners through a reflective process, integrates feedback, and enhances their ability to apply learning in future scenarios. It is not just a post-simulation assessment or a one-time event, but an ongoing process that promotes deeper learning and skill development. Question 10. Scenario. Mr. Hernandez is designing a simulation for a multidisciplinary team of healthcare providers, including doctors, nurses, and paramedics, to practice handling a mass casualty incident. The simulation is meant to improve team coordination, communication, and decision-making under pressure. What is the most critical aspect of this simulation designed to ensure the effectiveness of interprofessional education? A. Ensuring the simulation is conducted in a quiet, low-pressure environment to avoid distractions. B. Having each team member work in isolation to simulate individual tasks and responsibilities. C. Focusing on improving technical skills rather than communication and collaboration. D. Designing the simulation to foster collaborative decision-making, clear communication, and role clarification within the team. Answer. D. Designing the simulation to foster collaborative decision-making, clear communication, and role clarification within the team. Explanation. Interprofessional education emphasizes the importance of teamwork, communication, and collaboration among healthcare professionals. In a mass casualty simulation, the focus should be on fostering these skills by designing the scenario to encourage collaborative decision-making, clear communication, and role clarification. Team members must work together efficiently, especially under pressure, to manage the situation effectively. Simulating isolated roles or focusing solely on technical skills would not adequately address the teamwork and communication skills necessary in real-life health settings. Question 11. Which of the following strategies is most effective in enhancing a learner's ability to retain and apply skills learned during a simulation-based training program? A. Relying solely on high-fidelity simulations to engage learners with advanced technology. B. Providing opportunities for spaced repetition and practice with progressive complexity of scenarios. C. Ensuring the simulation is brief and does not exceed an hour to maintain learner engagement. D. Minimizing the use of feedback during the simulation to avoid overwhelming the learners. Answer. B. Providing opportunities for spaced repetition and practice with progressive complexity of scenarios. Explanation. Spaced repetition and progressively more complex scenarios are highly effective in reinforcing and retaining learned skills. This approach allows learners to apply knowledge in different contexts and build on previous experiences, enhancing their ability to retain and apply skills in real-life situations. High-fidelity simulations, useful but without repetition and increasing challenge, learning may not be as deep or transferable. Question 12. Scenario. In a medical simulation involving a cardiac arrest scenario, a nurse and a physician are working together to resuscitate a patient. During the scenario, the nurse repeatedly asks the physician for guidance, which leads to delays in delivering treatment. What could be the most effective intervention by the simulation facilitator to improve team performance during this situation? A. Providing the nurse with step-by-step instructions throughout the scenario to ensure tasks are completed. B. Intervening to reinforce the importance of clear, proactive communication and role-specific responsibilities. C. Allowing the physician to take over all decision-making to avoid further delays. D. Stopping the simulation immediately to provide an overall review of the nurse's performance. Answer. B. Intervening to reinforce the importance of clear, proactive communication and role-specific responsibilities. Explanation. In healthcare teams, clear communication and understanding of each team member's role are critical to efficient performance, especially in high-pressure situations. The facilitator should guide the learners to understand the importance of proactive communication and delegation of tasks to prevent delays, instead of taking over. Providing too much instruction, reinforcing teamwork and role clarity will allow the team to perform better in future scenarios. Question 13. What is a key consideration when designing simulations that incorporate high-fidelity mannequins or other advanced technology? A. Ensuring that the technology does not distract from the core learning objectives of the simulation. B. Prioritizing technological complexity over learner engagement to provide the most realistic experience. C. Focusing solely on the technical aspects of operating the equipment to ensure proper usage. D. Limiting learner interactions with the technology to prevent errors during the simulation. Answer. A. Ensuring that the technology does not distract from the core learning objectives of the simulation. Explanation. While high-fidelity mannequins and technology can enhance realism, it is important to ensure that they do not distract from the core learning objectives. The primary purpose of simulation is to teach skills, enhance decision-making, and improve teamwork, not simply to use advanced technology. The focus should remain on learning outcomes. Technology should serve as a tool to support those objectives, not overshadow them. Question 14. Which of the following best describes the role of reflective practice in healthcare simulation education? A. Reflective practice is solely about reviewing the technical aspects of the simulation for accuracy. B. Reflective practice is only effective if performed immediately after the simulation scenario is completed. C. Reflective practice encourages learners to critically examine their actions, emotions, and thought processes to improve future performance. D. Reflective practice is only useful when the simulation outcomes are negative and require correction. Answer. C. Reflective practice encourages learners to critically examine their actions, emotions, and thought processes to improve future performance. Explanation. Reflective practice is a process where learners critically analyze their experiences, including both the cognitive and emotional aspects, to learn from them and improve future performance. This type of reflection encourages a deeper understanding of personal strengths and areas for improvement. It is limited to reviewing technical errors, but also involves evaluating how learners approach problems, collaborate with others, and manage stress. Question 15. In the context of healthcare simulation, which of the following is the most effective way to assess the readiness of learners before engaging in complex simulation scenarios? A. Administering a theoretical exam that tests knowledge about the medical procedures. B. Conducting a pre-simulation briefing to review basic skills and ensure understanding of the scenario. C. Encouraging learners to observe the simulation without participating to assess their readiness. D. Using high-stakes assessments to determine if the learners are competent enough for the simulation. Answer. B. Conducting a pre-simulation briefing to review basic skills and ensure understanding of the scenario. Explanation. A pre-simulation briefing is essential to ensure that learners are prepared and understand the scenario and their roles within it. This review helps reinforce basic skills, clarify any doubts, and set expectations for the simulation. It also provides an opportunity for learners to ask questions and receive guidance before engaging in a complex simulation. Theoretical exams and observation may not adequately prepare learners for active participation or decision-making in simulations. Question 16. Which of the following is the most important factor to consider when designing a simulation scenario for interprofessional education? A. Ensuring that the scenario is designed solely for healthcare providers from the same discipline to minimize confusion. B. Focusing on technical proficiency without integrating communication and teamwork elements. C. Developing realistic scenarios where learners from different healthcare disciplines collaborate to solve complex problems. D. Prioritizing individual performance over team dynamics to assess each learner's clinical skills independently. Answer: C. Developing realistic scenarios where learners from different healthcare disciplines collaborate to solve complex problems. Explanation: the primary goal of interprofessional education in simulation is to foster teamwork and collaboration across different healthcare disciplines. Scenarios should reflect real-world situations where multiple healthcare professionals must work together to solve complex issues. Focusing solely on individual performance without incorporating interprofessional collaboration would not effectively promote teamwork skills, which are crucial in healthcare settings. Question 17. Scenario: Dr. Johnson is overseeing a simulation exercise in which a team of residents must manage a traumatic injury. During the simulation, one of the residents, Sarah, becomes visibly distressed and begins to exhibit signs of panic. Dr. Johnson notices this but is unsure how to address the situation in real time without disrupting the flow of the scenario. What should Dr. Johnson do in this situation? A. Ignore Sarah's panic to avoid interrupting the scenario, as it could be seen as part of the learning experience. B. Intervene immediately to provide a step-by-step guide for Sarah to follow in managing the situation. C. Pause the simulation and provide Sarah with an opportunity to process her emotions and discuss strategies for managing stress in high-pressure situations. D. Let Sarah continue without intervention, as it is important for learners to figure out their own coping mechanisms during the simulation. Answer: C. Pause the simulation and provide Sarah with an opportunity to process her emotions and discuss strategies for managing stress in high-pressure situations. Explanation: in simulation-based training, emotional responses such as panic are common, especially in high-stress clinical scenarios. It is important to address emotional distress promptly to ensure a safe and supportive learning environment. Pausing the simulation allows the facilitator to Sarah process her emotions, discuss stress management techniques, and re-engage with the scenario in a more focused and composed manner. Ignoring the situation or allowing the learner to struggle without support could compromise both their learning and psychological safety. Question 18. What is the primary advantage of using formative assessment in simulation-based training as compared to summative assessment? A formative assessment provides a final evaluation of the learner's competency in simulation scenarios. B. Formative assessment allows for immediate feedback and improvement during the simulation process, fostering learning in real time. C. Formative assessment is only applicable in low-stakes situations and is not useful for high-stakes clinical training. D. Formative assessment only focuses on evaluating technical skills, interpersonal or communication skills. Answer: B. Formative assessment allows for immediate feedback and improvement during the simulation process, fostering learning in real time. Explanation: formative assessment is designed to provide ongoing feedback during the learning process, enabling learners to improve and adjust their performance in real time. This approach is critical in simulation-based training as it helps learners understand their strengths and areas for improvement before completing the task or evaluation. Unlike summative assessment, which evaluates overall competency at the end of a training period, formative assessment promotes continuous learning and adaptation. Question 19. Which of the following is the most critical aspect of creating a psychologically safe environment for learners during a healthcare simulation? A. Ensuring that learners are evaluated solely on their clinical skills without considering emotional responses. B. Creating a space where learners can express concerns, ask questions, and make mistakes without fear of judgment. C. Minimizing the use of debriefing sessions to avoid causing learners to feel vulnerable. D. Prioritizing the performance of technical procedures over emotional or psychological well-being during simulations. Answer: B. Creating a space where learners can express concerns, ask questions, and make mistakes without fear of judgment. Explanation: psychological safety is essential for effective learning in simulation-based training. Learners should feel safe to express concerns, ask questions, and make mistakes without fear of judgment or negative consequences. This openness promotes deeper reflection, learning, and growth, fostering psychological safety, encourages critical thinking and self-assessment, which are crucial for developing the skills needed in real-world clinical environments. Evaluating learners solely on technical skills or avoiding debriefing would limit their ability to learn from the experience. Question 20. When incorporating simulation technologies like virtual reality, VR, or augmented reality into healthcare education, what is the primary consideration to ensure that the technology enhances the learning experience? A. The technology should be complex enough to simulate every possible aspect of a clinical scenario, even if it complicates the learning process. B. The technology should align with the learning objectives and provide an immersive, interactive environment that enhances decision-making and skills practice. C. The technology should be used as a replacement for hands-on training in order to save time and resources. D. The technology should be limited, providing visual feedback and avoid incorporating audio or interactive elements to reduce distractions. Answer. B. The technology should align with the learning objectives and provide an immersive, interactive environment that enhances decision-making and skills practice. Explanation. The effectiveness of simulation technologies like VR and AR hinges on their ability to align with the educational objectives of the simulation. These technologies should enhance the learning experience by providing an immersive, interactive environment that mirrors real-world situations. It helps learners practice decision-making, improve skills, and experience complex scenarios that would be difficult to replicate in traditional settings. Overcomplicating the technology or using it as a time-saving measure without a clear educational purpose would detract from its effectiveness. Question 21. In the context of simulation-based healthcare education, what is the primary purpose of debriefing after a simulation exercise? A. To evaluate the overall performance of the simulation facilitator and improve their teaching methods. B. To provide learners with a thorough critique of their technical skills and clinical decision-making abilities. C. To reflect on the simulation experience, identify areas for improvement, and enhance understanding through discussion and feedback. D. To assess the learner's ability to memorize specific protocols and procedures demonstrated during simulation. Answer. C. To reflect on the simulation experience, identify areas for improvement, and enhance understanding through discussion and feedback. Explanation. Debriefing is a critical part of simulation-based healthcare education. Its purpose is to allow learners to reflect on their experiences, discuss what went well and what could be improved, and receive constructive feedback from facilitators and peers. The debriefing process fosters a deeper understanding of scenario, enhances learning, and provides an opportunity for learners to consolidate their experiences. While technical skills and decision-making are discussed, debriefing is focused on the reflective learning process rather than a mere critique of performance. Question 22. Scenario. Sarah, a healthcare educator, has designed a simulation scenario to teach medical residents how to manage a cardiac arrest. She plans to incorporate both high-fidelity mannequins and standardized patient's SBS to represent the patient's condition and emotional state. The simulation involves both technical skills and interpersonal communication between the medical team and the patient's family members. What is primary goal in using both mannequins and SBS in this scenario? A. To evaluate the medical team's technical skills exclusively without considering communication with the family members. B. To enhance the realism of the scenario by incorporating both technical proficiency and effective communication under emotional stress. C. To limit the focus to technical procedures as the medical team's emotional responses are irrelevant in this situation. D. To create low-stakes environment that allows residents to practice basic skills without the need for patient interaction. Answer. B. To enhance the realism of the scenario by incorporating both technical proficiency and effective communication under emotional stress. Explanation. In this scenario, Sarah is using both high-fidelity mannequins and standardized patient's SBS to simulate a complex healthcare situation that includes not only technical skills, but also interpersonal communication. The use of SBS allows learners to practice how to communicate effectively with the patient's family, an essential aspect of patient-centered care, especially in high-stress situations. This approach enhances realism and better prepares learners for real-world clinical environments where both technical and communication skills are critical for patient care. Question 23. Which of the following best describes the role of competency-based education (CBE) in simulation-based training? ACB focuses primarily on assessing theoretical knowledge through written exams after simulation scenarios. BCB involves setting specific, measurable outcomes for learners and assessing their ability to meet those outcomes through simulation-based practice. CB emphasizes the importance of learner-driven pace and independent study rather than structured simulation scenarios. SB relies on pre-test and post-test evaluations to gauge learners' improvement without integrating formative feedback during simulations. Answer: BCB involves setting specific, measurable outcomes for learners and assessing their ability to meet those outcomes through simulation-based practice. Explanation: competency-based education (CB) focuses on ensuring that learners acquire specific, measurable skills and competencies required for their roles. In simulation-based training, CB sets clear learning outcomes and learners' progress is assessed based on their ability to demonstrate competency in clinical skills, decision-making, and other relevant areas through simulations. This approach promotes mastery learning and ensures that learners are able to perform the required tasks to high standard before moving on to more advanced training. It does not solely rely on theoretical exams or proposed test assessments. Question 24. What is the primary ethical consideration when using simulation-based training involving high-fidelity mannequins in scenarios that simulate end-of-life care or death? A. Ensuring that the scenario is focused on the technical aspects of the procedure with little attention given to the emotional impact on the learners. B. Ensuring that learners are exposed to high-stakes, emotionally distressing scenarios to prepare them for the realities of end-of-life care. C. Ensuring that the simulation respects the emotional well-being of the learners and provides appropriate support during debriefing. D. Ensuring that the learner's primary focus is performing clinical procedures without considering the emotional or ethical implications of end-of-life care. Answer: C. Ensuring that the simulation respects the emotional well-being of the learners and provides appropriate support during debriefing. Explanation: when using high-fidelity mannequins in end-of-life care simulations, it is crucial to be sensitive to the emotional responses of the learners. These types of simulations can be emotionally challenging, and it is essential to create a supportive learning environment where learners feel safe to process and reflect on emotions. Providing appropriate debriefing and emotional support allows learners to cope with the ethical and emotional complexities of end-of-life care. Ethical considerations include respecting learners' emotional responses and fostering a psychologically safe space for learning. Question 25. Which of the following is a key benefit of incorporating virtual reality, VR, or augmented reality, AR, into healthcare simulation-based education? A. VR and AR can replace traditional clinical experiences entirely, eliminating the need for hands-on practice in real healthcare settings. B. VR and AR can be used to simulate complex clinical scenarios that would be difficult or impossible to replicate in real life, enhancing experiential learning. C. VR and AR are only effective for simulating low-fidelity, simple clinical scenarios with no real-world application. VR and AR can only be used for technical skill training, not for improving communication or decision-making skills. Answer: B. VR and AR can be used to simulate complex clinical scenarios that would be difficult or impossible to replicate in real life, enhancing experiential learning. Explanation: virtual reality, VR, and augmented reality offer the ability to create highly immersive, interactive simulations that replicate complex clinical scenarios. These technologies allow learners to experience situations that would be too dangerous or difficult to simulate in real life. VR and AR are particularly effective for providing experiential learning opportunities, allowing learners to practice decision-making, clinical reasoning, and communication skills in realistic environments. While they do not replace hands-on practice in real healthcare settings, they provide additional value in terms of complexity and accessibility. Question 26. In the context of healthcare simulation, what is the primary purpose of incorporating a multidisciplinary team in a simulation scenario? A. To assess the technical skills of individual team members in isolation without considering team dynamics. B. To emphasize teamwork, communication, and collaboration between professionals from different healthcare disciplines in real-world situations. C. To focus solely on the leadership skills of the primary healthcare provider without involving other team members. D. To create a competitive environment among healthcare professionals from various specialties. Answer: B. To emphasize teamwork, communication, and collaboration between professionals from different healthcare disciplines in real-world situations. Explanation. The primary purpose of incorporating a multidisciplinary team in simulation-based training is to emphasize teamwork, communication, and collaboration. In real healthcare settings, professionals from different disciplines, such as doctors, nurses, pharmacists, and allied health professionals, must together effectively to provide optimal patient care. Simulation scenarios that involve a multidisciplinary team replicate this collaborative environment, helping learners develop the skills necessary to interact, communicate, and make decisions as a cohesive unit. Question 27. Scenario. Dr. Patel is a medical educator using a simulation to train her students on managing a diabetic patient with an acute complication. She is concerned that some students may feel overwhelmed by the complexity of the scenario and may not engage fully in the learning process. What is the best approach for Dr. Patel to address these concerns? A. Simplify the scenario by removing complex aspects and focusing only on one aspect of the condition. B. Provide students with additional reading materials to help them better understand the case before the simulation. C. Facilitate a pre-briefing session where learners are introduced to the scenario, given key learning objectives, and encouraged to ask questions. D. Skip the debriefing session to save time and avoid any emotional discomfort may arise. Answer. C. Facilitate a pre-briefing session where learners are introduced to the scenario, given key learning objectives, and encouraged to ask questions. Explanation. A pre-briefing session is an effective way to prepare learners for complex simulation scenarios. It allows educators to set clear expectations, provide essential background information, and discuss the learning objectives of the simulation. By addressing potential concerns and encourage students to ask questions, Dr. Patel can help reduce anxiety and improve engagement. A pre-briefing ensures that learners are mentally prepared for the challenge, which enhances their ability to perform in the simulation. Question 28. Which of the following is a critical factor to consider when designing a simulation-based training program for a high-stakes, life-threatening clinical scenario? A. Ensuring that the simulation only focuses on a single technical skill to avoid overwhelming the learners. B. Including frequent and high-fidelity feedback throughout the simulation to guide learners and improve performance. C. Limiting the duration of the simulation to prevent fatigue, even if this means omitting critical aspects of the scenario. D. Designing the simulation to include as many variables as possible without considering the learner's level of expertise. Answer. B. Including frequent and high-fidelity feedback throughout the simulation to guide learners and improve performance. Explanation. When designing a simulation for high-stakes, life-threatening scenarios, it is crucial to provide frequent and high-fidelity feedback. This feedback helps learners understand their actions and decisions in real time, enabling them to adjust their approach and improve their performance. High-fidelity feedback can come from instructors or even the simulation system itself. The goal is to provide a realistic and constructive learning experience that supports mastery and enhances performance in critical situations. Question 29. What is the role of psychological safety in simulation-based healthcare education? A. It allows learners to take risks, make mistakes, and learn from them without fear of judgment or repercussions. B. It encourages learners to avoid taking risks and stick to familiar procedures in order to minimize errors. C. It ensures that all learners perform the simulation perfectly without any mistakes to avoid feelings of discomfort. D. It eliminates the need for debriefing, as learners are not expected to reflect on their mistakes. And so it allows learners to take risks, make mistakes, and learn from them without fear of judgment or repercussions. Explanation. Psychological safety is a key component of effective simulation-based education. It creates an environment where learners feel safe to take risks, make mistakes, and learn from them without fear of negative consequences or judgment. This type of learning environment encourages open communication, self-reflection, focus on continuous improvement. When learners feel psychologically safe, they are more likely to engage fully in the simulation, take on challenges, and develop critical skills that will improve their performance in real-world scenarios. Question 30. Which of the following is a significant challenge when incorporating virtual simulations into healthcare training? A. Virtual simulations cannot replicate the human element, such as patient emotions and responses, limiting their realism. B. Virtual simulations are inexpensive and require minimal technology or equipment to be effective. C. Virtual simulations are less effective than traditional in-person training methods because they do not engage the learner in the same way. D. Virtual simulations are only suitable for basic skill practice and not effective for complex clinical scenarios. Answer A. Virtual simulations do not replicate the human element, such as patient emotions and responses, limiting their realism. Explanation. One significant challenge when incorporating virtual simulations into healthcare training is the inability to fully replicate the human element, such as patient emotions, responses, and the dynamic nature of real-life clinical interactions. While virtual simulations can provide valuable experiences, especially in terms of procedural practice and decision-making, they may not fully capture the nuanced emotional and psychological aspects of patient care. This can limit the realism of the simulation, which is a consideration when designing virtual training programs.